The knee is the largest joint in the body. It is made up of the lower end of the thigh bone, femur, which moves on the upper end of the shin bone, tibia, and the kneecap, patella, which slides in a groove on the end of the femur. Over time, a healthy knee can be damaged by disease such as arthritis or injury, leading to cartilage wear or degeneration within the knee. This may result in pain and lack of motion that affects day-to-day activities. When non-surgical treatments are no longer effective, it is time to consider total knee replacement. The surgeon will begin by making an incision on the front of the knee, just enough for the surgeon to see and access the joint. Once the surgeon exposes the knee joint, damaged bone ends are removed using special instruments and replaced with components designed to recreate the natural contours of the bones in a healthy knee. The metal and polyethylene plastic implants allow the bones to smoothly glide against each other, like a person's natural cartilage. Once the implant is positioned correctly, the surgeon tests the patient's range of motion. The incision is closed and a dressing is applied. The specifics of recovery and rehabilitation will be determined by the surgeon based on a patient's condition.